Today's top stories: Immunosuppressive Rxs in children. Infection risk screening: Medicare is paying less for cataract surgery. Nurses speak out on burnout, mandatory overtime, and burning the candle at both ends. Self-detection: male sex linked to thicker melanomas. Inflammatory hypothesis: proponents undaunted by ZEUS flop. Youth mental health model shifts care to community settings. BFR warning. Infant hypervitaminosis D needs vigilance. Stat plus. One of the most consequential years for cancer treatment ever. Knee osteoarthritis isn't inevitable. Here's what you can do. And schizophrenia's lost brain connections follow a surprising pattern. We start with immunosuppressive Rxs in children. Infection risk screening. Immunosuppressive Rxs in children. Infection risk screening. Minneapolis. The number and types of immunosuppressive therapies offered to children to control dermatologic diseases have expanded substantially, intensifying the focus on how to best conduct infection risk screening and prophylaxis prior to initiating these drugs. The risk is not uniform. You need to stratify by drug class, concomitant therapies, patient-level factors, and concomitant therapies that affect risk, especially corticosteroids, reported Bate K. Thielen, MD, PhD, Assistant Professor in the Division of Pediatric Infectious Diseases at the University of Minnesota, Minneapolis. Of the strategies to reduce risk for infectious complications of immunosuppressive therapies, Thielen emphasized attention to the potential for latent infections. A careful exposure history is one of the highest-yield prevention strategies, Thielen said at the Society for Pediatric Dermatology, SPD, 2026 annual meeting. Citing cases in which immunosuppressive drugs resulted in severe morbidity or even mortality from potentially preventable latent infections, Thielen outlined 6 questions to generate a history that will prevent such complications. 6 screening questions recommended originally. Medicare is paying less for cataract surgery. Tammy Chalala, a retired dietitian in New York, was thrilled with the results of her cataract surgeries, which left her with close to 20/20 vision. She said she paid nearly $4,000 out of pocket for her 2 surgeries last year because she opted to have her doctor use a laser to assist with the procedure. Chalala, 69, chose that method over the traditional scalpel after doing research online and consulting with her doctors, believing it would give her the best outcome. It seemed like the better option, she said. Cataract surgery, one of the most common operations paid for by Medicare, typically leaves enrollees owing a few $100s. Some patients pay more to have their vision corrected during the procedure. But like Chalala, a growing number of those patients are paying even more out of pocket simply because they agree to have their doctor use a laser rather than the scalpel method. Both methods are safe and can significantly reduce or eliminate the need for patients to wear glasses. However, many doctors say the laser helps make more precise cuts than the scalpel. The laser method gives patients more options, they say, and recoups more revenue as Medicare has gradually cooled. Nurses speak out on burnout, mandatory overtime, and burning the candle at both ends. Clancy Solis, DNP, RN, CNE, CCRNK, worked as a bedside nurse for 6 years before becoming a student success coach, nursing faculty and program leader at Joyce University of Nursing and Program Leadership in Draper, Utah. The bedside work was beautiful. I can remember so many amazing, soul-changing experiences I had, she said. Then there was also the idea that I really couldn't be a mom with that job. It was very, very hard. I didn't see my family as often. It was a double-edged sword. That mixture of difficulty within a dream nursing job is what prompted Joyce researchers to study nurse burnout. In a survey of 1,000 nurses across the U.S. in 2025, the study found that about 3/4 of all nurses surveyed reported feeling emotionally drained from their work several times a week. Many said they didn't feel rested enough to perform successfully on the job and worried that such fatigue would lead to making mistakes while caring for patients. 47% said they struggled to sleep most or all nights because of work-related anxiety, and 55% said they usually skipped meals or breaks on most shifts because they didn't feel they had the time to take them. The stew. Self-detection, male sex linked to thicker melanomas. TOPLINE in young adults with cutaneous melanoma, self-detection, and male sex were independently associated with tumor thickness greater than 2. Men experienced higher metastatic progression and melanoma-related mortality than women, with a median of 29.15 years of life lost among melanoma-related deaths. Methodology: Researchers conducted a retrospective cohort study of 316 patients, aged 18-44 years, with histologically confirmed primary cutaneous melanoma between January 1993 and December 2022. Of these, 177, 56%, were women mean age at diagnosis, 35.9 years, and 139, 44%, were men mean age at diagnosis, 35.5 years. Melanomas were self-detected, detected by relatives or friends, or detected by healthcare professionals. Reasons for consultation were recorded for self-detected cases. Outcomes included Breslow thickness greater than tomb, metastasis, melanoma-related death, survival, and years of life lost, calculated as the difference between age at death and sex-specific life expectancy. The researchers also assessed factors associated with thick melanoma, adjusting for age, sex, detection source, and anatomic site. The median follow-up duration was 142 months. TAKAWA. Inflammatory hypothesis proponents undaunted by ZEUS flop. When top-line results emerged from the ZEUS trial that investigational interleukin, IL-6 agent ziltivekimab failed to reduce major cardiovascular events in patients with high-risk heart plus kidney disease, some saw it as a blow to the inflammatory hypothesis. Targeting IL-6 was supposed to reduce inflammation in these patients with atherosclerotic cardiovascular disease, ASCVD, chronic kidney disease, and high C-reactive protein. The monoclonal antibody appeared to hit that mark, cutting both levels of the pro-inflammatory cytokine at targeted and high-sensitivity C-reactive protein, HSCRP, as a marker of inflammation. However, ziltivekimab had almost no impact on major adverse cardiovascular events compared with placebo, hazard ratio, 0.99, 95% CI, 0.88111, as drug developer Novo Nordisk announced in a statement on July 31. Rather than generalizing the lesson of the neutral trial as a critical blow against the causal role of inflammation in ASCVD, proponents of that so-called inflammatory hypothesis say it's just part of the process in building evidence for how to treat within that framework. Another signal that broad is better than narrow when targeting inflammatory pathway. Youth mental health model shifts care to community settings. A nationwide youth mental health service model that shifts care from hospitals and other institutional settings into community-based services can improve care and relieve pressure on the Canadian health system, new research showed. Researchers found that compared with young people who received standard community mental health care, those who received care through an Access Open Minds site saw greater reductions in hospital admissions, outpatient, specialist, and general practitioner visits, and admissions to public residential treatment facilities. Published online on July 7 in The Lancet Psychiatry, the research also showed that during the study period, the Access Open Minds program saved an average of $4,355 per person annually, or almost $10 for every dollar invested. What we're seeing in the largest site in this network is that this model delivers better care that is also in community settings and closer to where people live, as well as a return on investment, said study author Jai Shah, MD, assistant professor in psychiatry at McGill University, and co-director of the Prevention and Early Intervention Program for Psychosis in Montreal. Reduction in use of intensive service. BFR warning, infant hypervitaminosis D needs vigilance. A high-dose vitamin D supplement for adults instead of the usual treatment to prevent rickets. The German Federal Institute for Risk Assessment, BFR, has once again reported a case of severe vitamin D intoxication in an infant. The case illustrates how quickly highly concentrated supplements in particular can become dangerous, and which symptoms should raise suspicion of hypervitaminosis D in clinical practice. High-dose adult supplement led to intoxication. Vitamin D is part of established preventive care for infants. However, supplementation itself can pose a health risk if unsuitable or highly concentrated supplements are used. In July 2026, the BFR was again notified of a severe case of vitamin D poisoning in an infant. According to the Institute, the cause was the incorrect administration of a high-dose dietary supplement intended for adults, which the parents had purchased online. A similar case had already been reported to the BFR at the end of 2021. These case reports are also relevant because vitamin D supplementation in infancy is standard medical practice. Infants cannot adequately meet their needs through cutaneous synthesis. At the same time, breast milk provides only. Stat Plus, one of the most consequential years for cancer treatment ever. Adam Feuerstein is a senior writer and biotech columnist, reporting on the crossroads of drug development, business, Wall Street, and biotechnology. He is also a co-host of the weekly biotech podcast, The Read Out Loud, and author of the newsletter Adam's Biotech Scorecard. You can reach Adam on Signal at StatF54. This story first appeared in Adam's Biotech Scorecard, a subscriber-only newsletter. Stat Plus subscribers can sign up here to get it delivered to their inbox. 24 hours later, my brain is still whirling over yesterday's stunning news from Merck and Moderna about the success of their personalized mRNA cancer therapy in a melanoma late-stage clinical trial. Advertisement: I posted this on X yesterday, but it's worth repeating here. Between this spring's Revolution Medicine's success with a KRAS-targeted drug and now Merck and Moderna's success with an mRNA neoantigen vaccine, 2026 will go down as one of the most consequential years in cancer treatment ever. Adam Feuerstein is a senior writer and biotech columnist, reporting on the crossroads of drug development, business, Wall Street, and biotechnology. He is also a co-host of the weekly biotech podcast, The Read Out Loud. Knee osteoarthritis isn't inevitable, here's what you can do. Knee osteoarthritis is not inevitable, a circumflex, here's what you can do. Date: August 20, 2026. Source: Siteman Cancer Center. Summary: knee osteoarthritis can seriously affect mobility and quality of life, but its progression is not completely out of your control. Exercise, stronger leg muscles, a healthier diet, and even modest weight loss can dramatically reduce stress on the knees and help keep pain in check. Share: knee pain is a familiar problem for many people, particularly as they get older. Although persistent knee discomfort can have many causes, osteoarthritis is one of the most common. Knee osteoarthritis develops as the cartilage that cushions the bones in the joint gradually breaks down. Healthy cartilage allows the knee to move smoothly while helping protect the bones. As this protective layer becomes thinner, pain and other problems can develop and may become more severe over time. Osteoarthritis can cause knee pain and stiffness, which can negatively impact a person's activity level, risk of falling, mood, and general quality of life, said Dr. Abby Cheng, an orthopedic surgeon at Washington University School of Medicine in St. Louis who also specializes in physiat. Schizophrenia's lost brain connections follow a surprising pattern. Schizophrenia's lost brain connections follow a surprising pattern. Schizophrenia may erode the brain's connections in a surprisingly organized pattern that researchers can now begin to trace back to where it may start. Date: August 20, 2026. Source: Rutgers University. Summary: specialized brain scans reveal that schizophrenia is linked to widespread loss of the synapses that connect brain cells, with the left side of the brain hit especially hard. The damage follows a surprisingly organized pattern tied to the brain's chemistry and wiring. Researchers also identified a left frontal region that may serve as a starting point for the loss. Share: researchers, including a Rutgers professor, have gained a clearer view of the biological changes associated with schizophrenia by directly measuring synaptic connections in the living human brain. The team used specialized positron emission tomography, PET, imaging to examine these crucial points of communication between brain cells. The study, published in Molecular Psychiatry, was led by senior authors Avram Holmes, Associate Professor of Psychiatry at Robert Wood Johnson Medical School and core faculty member of the center. That's all for this news briefing. Thanks for listening. Also, don't forget to hit the subscribe button.